So this is a very interesting patient. He is Shivappa from a nearby rural place who came to us with severe back pain and difficulty in walking and deformity of the back, making him unable to stand and walk and work. If you can have a look at the X-ray, normally the spine is supposed to be straight. But in his case, because of excessive wear and tear of the joints and arthritis, the spine has become curved. And that's why he is having severe pain in the back, because there is eccentric loading of the back. And the space in between the bones is significantly reduced. As you can see in this MRI, so there are multiple areas where the nerves are getting blocked. So he has 2 or 3 issues. Number 1, severe back pain because of deformity and arthritis. Number 2, difficulty in walking. And number 3, severe compression of the nerves. So what we have done is, most important, release of the nerves, called as lumbar decompression. If we had just done that, then he would have had relief of the nerve problems, but the spine would continue to become deformed and pain. So we have, in addition, done what is called as a fusion operation, where we fix the back and we also do a fusion so that the back becomes strong, using some screws and rods to fix the back. Just as if you have a fracture in the hand, which doesn't get better with plaster, then we have to put a plate, something similar to that. So we have fixed 5 segments of the spine which were getting crooked and deformed, and we have also done a strengthening procedure called as a fusion. So he has nerves decompressed and spine stabilized. Now once the back heals, within a few days and weeks, he should have a strong back and released nerves. Post-operatively, although this is a big operation, because of the stability, we plan to get him out of bed and walking in the next couple of days. Thank you.